For anyone who's been through surgery, you know it usually begins with a doctor telling you to count backwards from 10. The first thought upon hearing this is that you're not tired at all, and this seems like not nearly enough time. But then, funny enough, you make it to just 7 before the next thing you know you're waking up groggy in an entirely different room hours later with the surgery completed. Or at least, that's most people's experience. For an incredibly unlucky few, what comes next is one of the most disturbing things that can happen to a person. Instead of waking up after the surgery, they wake up during the surgery, and what follows can only be described as a living nightmare. Filled with a cocktail of medications to keep them from moving, they're awake, fully aware, and feeling everything. But horrifyingly, they're also paralyzed and unable to move or tell anyone they're awake. And they can feel every surgical instrument moving around inside them, and yet there's absolutely nothing they can do. These are some of the horrifying incidents of people waking up during surgery. And I'm going to be honest with all of you. This is a topic I knew a little bit about, but upon really getting into it, I found it to be so disturbing that I almost actually wish I didn't know about it after all. So suffice to say, now more than ever, although the events in this video are fleeting and non-descriptive, they are still highly disturbing, so viewer discretion is strongly advised.
In 2008, 44-year-old Donna of Manitoba went in for what was supposed to be a routine exploratory surgery. She'd been battling severe abdominal pain and heavy bleeding for a while, and doctors hoped to finally pinpoint the cause. Donna had been under general anesthesia before and never had a problem, so she trusted the process. After all the necessary preparations, a nurse wheeled her into the operating room, reassuring her with all the usual words, "Don't worry, we'll take care of you." On the table, monitors were hooked up, a mask was placed over her face, and with a few deep breaths, she drifted off. The next thing Donna knew, she was awake, and at first she thought the surgery was over. General anesthesia has this way of making you feel like you've time traveled, with hours passing in what seems like the blink of an eye. There was also a pleasant, hazy relaxation she felt, the kind you get when anesthesia is wearing off. But then she heard something else. It felt like the surgical team was still prepping. Then she felt them scrub her abdomen, and then she clearly heard the surgeon ask for a scalpel. This is when her nightmare began. Donna then felt the scalpel slice into her stomach. Instinctively, she tried to sit up, but she couldn't move a muscle. It was like her body had been turned to stone and she was pinned to the bed by an invisible weight. What she didn't know at that moment was that she had been given a paralytic drug along with the anesthesia. So while her brain had jolted her awake, her body was completely locked down. So she couldn't move, couldn't speak, and couldn't scream, but she could feel everything. The pain afterward was excruciating and relentless as she endured 90 minutes of pure agonizing torture. Desperate to signal she was awake, Donna managed to twitch her foot 3 times. Each time, someone placed a hand on it to keep her from moving, but no one said a word or acknowledged that Donna might be awake. And trapped in this silence, her mind raced. Her heart was pounding at nearly 150 beats per minute, yet the ventilator was set to give her only 7 breaths per minute. This made it feel like her lungs were on fire. At one point, she even heard a nurse shout at her to breathe, but paralyzed and intubated Donna couldn't. Eventually, she figured out that she could move her tongue, so she wiggled it against the breathing tube stuck down her throat, hoping someone would notice. And the anesthesiologist did, but he pulled the tube out, mistaking it as a sign that she was coming out of paralysis, but the paralytic drug was still very much working. So now, without a ventilator to breathe for her, Donna lay there, suffocating, and that's when she slipped away. She felt herself leave her body, hovering somewhere beyond the pain and terror of all she had experienced. She could still hear the room, but faintly, like it was through a wall. And instead of agony, she felt warmth, comfort, and the presence of what she believed was God. According to her, a voice then told her, "Whatever happens, you're going to be okay," and then she was snapped back into her body. The first thing she heard on her return was the anesthesiologist shouting for nurses to bag her or begin the use of a manual resuscitator. Air was then forced into her lungs and the burning vanished, and finally she could breathe again. A drug to counteract the paralytic was then administered, and eventually Donna could speak, but what could she possibly say to describe what she had just endured? After the procedure, she met with her surgeon and asked him if he had noticed that she hadn't asked what her diagnosis was. He then paused for a moment and asked if it was because she already knew what it was. She obviously did, because she was awake to hear it. The doctor's response to this was cold, though. When she confronted him, he simply shrugged and told her that awakening during anesthesia happens sometimes before walking out of the room. It would take 6 years and a lawsuit before Donna finally received an apology, but she never got the one thing she really wanted, which were answers as to how and why her worst nightmare had been allowed to happen. General anesthesia is a marvel of modern medicine that most of us take for granted. You're rolled into an operating room, a mask goes over your face, or a drug slips into your IV, you're asked to count backwards from 10, and before you know it, you're out cold. The mix of medications used, however, doesn't just knock you unconscious. It also numbs pain, erases memory, and with the help of a paralytic drug, keeps your body perfectly still so surgeons can work without interference. Without these, modern surgery as we know it wouldn't exist. And before safe anesthetics came along roughly 175 years ago, surgery was a nightmare scenario performed on fully conscious patients who had little more than alcohol, leather straps to bite on, and raw grit to get them through. Here's the twist though. Roughly 60,000 people in the US go under every single day, yet despite anesthesia being such a routine part of medicine, doctors still don't fully understand exactly how it works. We've got some ideas, like research suggesting the drugs tamper with proteins and nerve cell membranes, blocking pain signals from reaching the brain. Others alter neurotransmitters, which are the tiny chemical messengers that make your nervous system tick. A Duke University study published in 2019 also even found that several anesthetics essentially hijack the very same sleep circuits in the brain that naturally shut us down at night. But again, although the science is progressing, there's still a lot about anesthesia that remains mysterious. And that uncertainty is one reason why something called anesthesia awareness can sometimes slip through the cracks. It's rare, but it happens. Surveys suggest that up to 1 or 2 patients per 1,000 recall some sensation or awareness during surgery, though most experiences are fleeting and not painful. More rigorous studies, including the largest to date, covering 3 million patients in the UK and Ireland, put the rate of definite, distressing awareness closer to 1 in 19,600. This is slightly reassuring, but at the same time the risk can also rise sharply in certain situations. Like for example in emergency C-sections, where doctors have to keep anesthesia lighter, the rate was about 1 in 670. Now you might also be wondering why, despite the effectiveness of anesthetics in general, can anesthesia awareness happen, especially given how many people it's been used on? You'd think we'd have the dosing pretty dialed in by now. The answer, unfortunately, isn't so simple. Doctors know that certain factors can increase the risk, things like drug or alcohol dependency, obesity, severe medical conditions that prevent deep sedation, or even simple human error or faulty equipment, but they still can't reliably predict who will be affected. Some researchers have even identified possible genetic variations that may allow memories to form under anesthesia, which could explain why one patient might wake up while another under the exact same drugs doesn't. And even when patients do become aware during surgery, experiences vary. Some only hear voices or feel pressure, while others describe choking, suffocating, or the horrifying sensation of being operated on while being paralyzed and unable to scream. Thankfully, most of these episodes last less than 5 minutes, but even that brief window can leave lasting scars. Some studies show that about 40% of patients who wake up during surgery suffer long-term psychological consequences. This includes stuff like post-traumatic stress disorder, anxiety, and depression, or even worse sometimes. In January of 2006, a 73-year-old Baptist minister named Sherman checked into Raleigh General Hospital in North Carolina. And Sherman wasn't just a man of the cloth, he was also a retired coal miner, someone who had spent life doing grueling work before dedicating himself to the congregation. Leading up to that January though, he'd been plagued by reoccurring abdominal pain, and doctors scheduled an exploratory surgery to get to the bottom of it. Like Donna 2 years later, Sherman's surgery was supposed to be routine. The plan was to put him under general anesthesia, administer a paralytic to keep his body still, and figure out what exactly was going on inside his abdomen, but something went terribly wrong. The paralytic worked exactly as intended, freezing his body in place. The inhaled anesthetic, however, failed, and Sherman was completely awake. So paralyzed, unable to move or speak, and with his eyes taped shut, he was plunged into something unimaginable. He couldn't see what was happening around him, but he could feel everything: the incisions, the tugging, and the probing. Every sensation reached his brain in full force. For 16 agonizing minutes, he was trapped inside his own body before the surgical team realized that Sherman was likely awake and aware. When they did, they quickly administered an amnesia-inducing drug, hoping to erase his memory of the experience. Then after the surgery was completed, doctors never told him what had occurred. On paper, Sherman's mind was supposed to have been wiped clean of those horrifying minutes, but for some reason his body and brain didn't let go so easily. Almost immediately afterward, he began suffering panic attacks and crippling insomnia to the point where he refused to be left alone. At night, he was also plagued by vivid nightmares and even started to have delusions that people were trying to bury him alive. And Sherman had no history of psychological issues before the surgery. Nothing like this had ever bothered him in his 73 years, but the trauma of anesthesia awareness had broken something deep inside of him. Just 2 weeks after the surgery, tragically, Sherman would end things. Doctors also determined that his abdominal pain had likely been related to gallbladder problems, but for Sherman, the cause didn't matter anymore. The distress of those 16 minutes of awareness during his surgery became so much for him to bear that life afterward felt unlivable. On October 2nd, 2019, 34-year-old Stacey Gustafson was calm and relaxed. She was going into Denver's Rose Medical Center for a hernia operation, but she had been through multiple surgeries before and felt like a cool and confident veteran at them. What happened on the operating table that day, however, turned into the darkest moment of her life and one she still relives every day since. Stacey's anesthesia awareness began the moment her surgery did. She had been given drugs to paralyze her body, leaving her unable to move, but almost nothing to ease the pain or keep her unconscious. In fact, her IV line, which was supposed to deliver propofol, the short-acting anesthetic that would knock her out, wasn't even connected to her. Instead, the drug was pumping straight onto her bed. She remembers blackness and an eerie void where she couldn't move or speak, but she could feel everything. The first jolt was the searing across her abdomen before the pulling, ripping, and burning as the surgeons worked inside her. The only way she could describe it was like her insides were being torn out, where she witnessed and felt it all. Meanwhile, she could hear the voices of the surgical team, the doctor giving instructions, and even someone cracking a joke about a truck driver, all while her body was screaming in silence. Stacey fought desperately to signal she was awake. She tried to move her hands, her feet, anything, but her body refused to respond. She even thrashed her head as much as she could, though to the surgical team they appeared as faint, inconsequential movements. Over time, her panic built into pure horror as she continued to be trapped in her own body while being cut open. Medical records later confirmed that 22 minutes into the operation, staff noticed, quote, purposeful movement with head. They then peeled back the tape covering her eyes to check, then decided she wasn't showing enough signs of consciousness to stop. Instead, they gave her an inhalation agent and carried on with the procedure for another 13 minutes. It wasn't until someone finally noticed her IV line leaking onto the pillow that the horrifying mistake came to light. Only then was Stacey properly put under, but by that point, the damage had already been done. When she woke up in the recovery room, she was hysterical as she cried in panic, demanding to know what had happened to her. This is when she was told the truth about how the anesthetic line had been disconnected, which resulted in more than half an hour of Stacey lying fully conscious while paralyzed on the operating table. As you might imagine, the aftermath of the experience has also been devastating. Stacey describes it as something straight out of a horror film or torture chamber, and the trauma associated with it left her with severe PTSD and relentless flashbacks. She says that it's so scarring that she made the decision not to have more children, as she remains terrified of ever needing a C-section or having to face an operating room again. And this psychological toll also ripped into every corner of her life. Before surgery, Stacey had applied for a promotion at her marketing job, but afterward the trauma was so overwhelming that she withdrew her application, feeling too fragile to handle a more demanding role. Years later, therapy has helped, but the memories remain forever etched into her mind. In 2002, 48-year-old Diane went in to have a painful abscess treated and 2 lower teeth removed under general anesthesia in the United Kingdom. She had been given a preoperative sedative through an IV in her hand and felt the familiar wooziness that signals you're about to drift off. But when members of the surgical team started counting backwards from 10, Diane didn't fall asleep the way she should have. Instead, she found herself being wheeled through the doors of the surgical suite, fully conscious and suddenly terrified. She tried to call out to someone or even raise her arm to alert the team something was wrong, but she couldn't move. So next, paralyzed and panicking, she screamed inside while those in the operating room carried on around her as if nothing was wrong. From her vantage point, she heard the surgeon ask for a clamp to keep her mouth open, and he had no idea she was awake. Then he began to remove teeth. Diane felt him lean over her before an electric pain shot through her entire body. Her heart was beating so hard during this that she thought she might have a heart attack from the shock alone. At one point, she even heard the surgeon mutter, "It's a toughie," referring to one of her teeth before asking for a scalpel. That's when Diane mercifully blacked out from the pain. When she came to, nurses were stitching up her wounds, which she also felt fully. It was only after they gave her the antidote to the muscle relaxant that she bolted upright and screamed. Diane was then inconsolable as she sobbed and shook in utter shock. As she eventually composed herself, Diane told all the nurses their names because she overheard them in conversations, and she even told them how many stitches were put into her mouth. The cause of her anesthesia awareness finally came out in hospital inquiry. The vaporizer that supplies anesthetic gas to the mouth had been broken, and the oversight was ruled to be negligence on the part of the anesthesiologist. For Diane, though, as with so many others, the psychological fallout was devastating. She now suffers from anxiety, depression, and at times she feels like ending things. And quite obviously, she developed a paralyzing fear of dentists and any medical procedure as a result of her petrifying experience. In June of 2024, 67-year-old Barbara was rushed to a hospital in the United Kingdom for emergency surgery for a perforated bowel. Barbara again was no stranger to the operating room, but maybe more so than most. Over the course of her life, she'd endured more than 40 surgeries. Decades earlier, she had survived a devastating head-on car crash involving a vehicle being chased by police. And since then, the operating table had become a familiar, if unwelcome, part of her life. But in all of those times, she never once experienced anything out of the ordinary under anesthesia until then. Barbara remembers being sedated, slipping into what she thought would be the familiar, dreamless void of surgery, but the next thing she knew, she was awake, but not in the sense of drifting toward recovery. Instead, she was terrifyingly aware of everything happening around her while her body lay paralyzed. To her, it felt like she'd been buried alive. She was completely frozen, trapped, and helpless. And like others who've experienced anesthesia awareness, she described it as something straight out of a horror film. Somehow, despite the paralytic drug coursing through her veins though, she managed to move her right hand just enough to signal to the surgical team that something was wrong. The doctors noticed and quickly increased her dose of anesthetic, finally pulling her back under, but for the long term, it would matter little. For Barbara, who had faced decades of medical battles without ever flinching at the prospect of anesthesia, this one accident was enough to rattle her deeply. The experience left her traumatized, and she later admitted it had triggered PTSD. Despite everything she'd endured over the years, she said nothing compared to those few moments of trapped awareness that came during that procedure. Decades earlier, in 1998, Carol went in for surgery to repair her eye. She expected the usual, sedation, a drift into unconsciousness, and then waking up in recovery with the work already done. But what happened to her stayed with her every single night since. Partway through the procedure, Carol became aware. Just like in the other story, she couldn't move, but she could hear everything in the room. One line in particular burned deep into her memory as the surgeon instructed a trainee to, quote, cut deeper into the eye. Carol tried to scream, and in her mind she was screaming, but her body stayed completely still. She tried to wiggle her toes and even push herself off the table, anything to make them see she was awake, but horrifyingly, nothing happened. The paralysis locked her in place, leaving her feeling like she was dying right there on the table. Unlike others though, Carol didn't feel any sharp pain. Instead, it was the strange sensation of tugging and the unmistakable feeling of someone working inside her body while she was powerless to stop it. That lack of real pain didn't make the experience any less traumatic though. The psychological aftermath never left her. To this day, she can't lie flat on a bed without flashbacks of the operating table overwhelming her. The moment her body stretches out, her mind goes straight back to that surgical room and she begins thrashing violently. As a result, for more than 2 decades, she slept in a recliner instead because she found it's the only thing that can keep the fear at bay. Strangely though, not every case of anesthesia awareness ends up being a psychologically scarring incident. Like for example, in 2007, 67-year-old chef Peter went into surgery on the Isle of Wight to have his hip replaced. Years of playing rugby had finally worn down his joints, and the pain had reached the point where a new hip was the only option. Before he was wheeled into the operating room though, Peter met with the surgeon and made a very specific plea. Peter begged him to make sure he was knocked out cold because he can't stand pain. This was a bit of an ironic statement considering the rough sport he played, but this plea, as it would turn out, would be some horrific foresight. Peter was put to sleep and he drifted off into the quiet of anesthesia, but almost immediately he came back to. His senses then told him something was wrong as a strange smell hit his nose. It didn't take him long to realize what it was. He was catching the scent of his own bone being sawed away. Peter could even feel the raw vibration through his body as surgeons hammered the hip replacement into place. Unlike many of the victims in the previous stories, however, Peter felt no pain at all. The painkillers were doing their job at least, but he was unmistakably conscious, aware, and listening to everything happening in the room. It's unclear whether Peter was also given a paralytic drug, but as surgeons worked on his hip, he spoke up, apparently saying, quote, "Excuse me, but I'm awake." The surgeon, also apparently unfazed by his patient suddenly chatting with him, gave Peter an answer he never expected. In complete deadpan, the surgeon said they had woken him up intentionally because Peter was snoring so loud that it drowned out the surgical team's conversation. A moment later, Peter was put back under and he suffered no lasting effects from his experience. A decade earlier, Anne had a less polite way of letting her surgeon know that she was awake during her procedure. In 1994, the 60-year-old was rushed to a hospital in Cardiff, Wales for an emergency surgery to remove a growth in her colon. She was anxious, but she lay on her back as a mask was placed over her mouth and the anesthesiologist asked her to count backwards from 10. Under normal conditions, patients don't make it all the way down to 1, but Anne did twice. On the third try to put her under, she made it down to 2 before finally going silent, and by then she had received 3 times the normal dose of anesthetic. And yet somehow this still wasn't enough. Partway through the operation, Anne woke up. She apparently heard shouting in the operating room and half lucid told whoever it was to quiet down. It was only then that one of the nurses informed her that the screaming she heard was coming from her own mouth. In a panic, Anne managed to wrench her foot free of the stirrups and kick her surgeon squarely in the chest, and he went flying backwards on his wheeled stool. It was almost like a scene out of a slapstick comedy routine rather than a medical procedure. And just like Peter, Anne came out of it with no lasting trauma. In fact, she viewed the incident as more of a strange anecdote to share at dinner parties than a nightmare. Her family history, as it turns out, may have played a role in her becoming aware, as her mother was resistant to anesthesia as well, and one of her sons would later show the same trait. If there's anything to take from all of this, it's that these stories show just how unpredictable anesthesia awareness can be. For some, it's 90 minutes of agony that leaves lifelong scars. For others, it's a surreal, almost comical memory. But whether the experience comes with searing pain, paralyzing fear, or bizarre absurdity, the common thread is the same. The patient was supposed to be unconscious, and then they weren't. General anesthesia is one of the greatest medical advances in history, but it isn't foolproof. It requires vigilance, constant monitoring, and quick responses when things don't go as planned. Equipment can fail, dosages can be miscalculated, human error can creep in, and sometimes a patient's own biology resists the drugs. For those unlucky enough to wake up during surgery, the aftermath can be devastating with flashbacks, anxiety, depression, and even PTSD that lingers for years, or in Sherman's tragic case, ends a life. For others, like Anne, the experience becomes a funny footnote in their medical history. And this range of outcomes only underscores how much there still is to learn about how anesthesia truly works. And if there's one other takeaway from these accounts, it's this. Patients do have the right to ask questions, and one of the most important is whether the anesthesiologist will remain in the room during the entire procedure, or at least whether an anesthesiologist assistant will. The answer to that question should always be yes, because while anesthesia has made surgery safer than ever and the overall rate of something happening is extremely low, the difference between a dreamless sleep and a waking nightmare could come down to how closely someone is watching you. If you made it this far, thanks so much for watching. If you have a story suggestion, feel free to submit it to the forum found in the description. Also, if you want to support the channel, consider joining the Patreon or becoming a channel member here on YouTube. Anyways, thanks again, and hopefully I will see you in the next one.